Diabetes symptoms, skin signs. Diabetes can have an impact on various body parts, including the skin. Although certain skin changes are an early sign of diabetes, others are visible in the later stages of the disease. Although few skin lesions are commonly found with diabetes, some skin abnormalities are generic and can affect anyone. In fact, skin issues are occasionally the first indication that a person has diabetes. However, diabetics gain more readily. Before we continue, help us make this video the record holder for likes on our channel. Your likes not only show support, but also help YouTube recognize the video's relevance, leading to a wider distribution and increased awareness. If you haven't subscribed to our channel yet, we invite you to do so and activate the notification bell to stay updated with our latest content. Additionally, please share this valuable knowledge video with your friends and family, spreading awareness and empowering others with important information. Together, we can make a difference and create a positive impact. You can also tweak things out. So, let's go over each indication individually. Acanthosis nigricans. Ever notice a black spot or a velvety skin ring on the back of your neck? In addition to the neck, it is also noticeable in the groin and armpit regions. Obese people frequently exhibit it. Acanthosis nigricans, a symptom of elevated blood sugar, is a medical name for this illness. Consult your doctor if you observe these kinds of skin changes because they could be the first indication that someone has diabetes. Numerous potential problems can be avoided by diabetes early identification. Skin tags. Skin tags are the following crucial characteristic. Although it's common and innocuous for people to have a few skin tags or other skin growths, you can see from these numerous skin tags that a blackish tint of the skin could be an indication of high blood sugar levels. You may notice yellowish, reddish, or brown spots on your skin. These growths are most frequently found on the eyelids, neck, armpit, and groin area. This skin condition frequently starts off as a small, firm, raised lumps that resemble pimples. As it worsens, these bumps develop into patches of swollen, hard skin. Necrobiosis lipoidica. The blotches can be brown, reddish, or yellow. You might also observe that the surrounding skin has a shiny porcelain-like look, and that blood vessels are visible. The skin is unpleasant and itchy, and the skin illness goes through cycles of being active, inactive, and then active once more. Necrobiosis lipoidica is the official name for this ailment. Get tested for diabetes if you notice this type of skin lesion. Skin thickening. Skin hardening or thickening is the following significant change. Digital sclerosis, which manifests as thick, waxy skin on the back of the hands and causes the finger joints to stiffen and become difficult to move, affects about 1/3 of patients with type 1 diabetes. Additionally to the feet and forehead. This skin condition might occasionally affect the knees, ankles, or elbows. In this case, physical therapy may be beneficial and moisturizer can assist soften the skin. Diabetic dermopathy. Spots that leave a barely perceptible depression in the skin are caused by the skin disorder. It frequently affects those with diabetes. Diabetic dermopathy is the official name and it typically develops on the shins. However, it can also occur on the arms, thighs, trunk, or other parts of the body in extremely rare circumstances. As a result of the spot's lack of symptoms, many people mistake it for age spots. These spots and lines, unlike age spots, typically begin to vanish after 18 to 24 months. Diabetes-related dermopathy also has a long-lasting effect on the skin. Bullosis diabeticorum. People with diabetes occasionally experience the emergence of blisters on their skin. A sizable blister, a cluster of blisters, or both may be seen. The blisters resemble those that develop after a severe burn and commonly develop on the hands, feet, legs, or forearms. Now, these blisters are not painful in contrast to the blisters that appear after a burn. Eruptive xanthomatosis. In uncontrolled hyperglycemia, eruptive xanthomatosis is a common complication. When these bumps first appear, they frequently resemble pimples, but unlike pimples, they soon turn yellow. These lumps can form anywhere, although they are most frequently found on the buttocks, thighs, elbow crooks, or backs of the knees. Now, regardless where they emerge, they are typically sensitive and irritating, and when diabetes is under good control, these yellow pimples quickly go away. Frequent skin infections. Infections of the skin, whether bacterial or fungal, are common in people with diabetes. Styes, an infection of the glands or eyelids, folliculitis or an infection of the hair follicles, carbuncles or deep infections of the skin and the tissue beneath are bacterial diseases that are frequently encountered in people with diabetes. Diabetes is also particularly susceptible to fungal infections, which are most frequently seen in warm, moist skin folds like those around the nails, between the fingers and toes, in the corners of the mouth, under the breast, and in the armpits and groin area. Itchy vaginal infections, ringworm, jock itch, and athlete's foot are examples of common fungal infections. Open sores and wounds. Long-term high blood sugar levels might cause impaired circulation and nerve damage. If you've had uncontrolled diabetes for a long period, you might have developed this. Your body may have a difficult time healing wounds if you have poor circulation or nerve damage, which is particularly true on your feet. If you have diabetes, you should inspect your feet every day for sores and open wounds. These open wounds are known as diabetic ulcers. Itching. Diabetes frequently contributes to localized itchiness. Dry skin, a yeast infection, or inadequate circulation are possible causes. The lower portions of the legs could be the itchiest region when inadequate circulation is a source of itching. Now you might be able to relieve itching on your own by limiting how frequently you bathed, especially in dry climates, using mild soap with moisturizer, and using skin cream after bathing. In light of the foregoing, it is crucial to link any of the aforementioned symptoms to other risk factors including obesity, a family history of diabetes, or leading a sedentary lifestyle. This is especially critical if you detect one or more of the symptoms listed above. Having only one symptom does not necessarily mean you have diabetes. It can also be an indication of other conditions. However, if you are over 40 and in this high-risk group, it is advisable to monitor your blood sugar levels frequently. Numerous issues can be avoided in the future with early diabetes detection and vigilance. Diabetes prevention is a critical aspect of maintaining overall health and well-being. While some risk factors for diabetes, such as age and family history, are beyond our control, there are several lifestyle changes and strategies that can significantly reduce the risk of developing diabetes. Remember, prevention is always better than cure when it comes to diabetes. By adopting a healthy lifestyle, making informed dietary choices, engaging in regular physical activity, maintaining a healthy weight, and seeking regular medical care, you can significantly reduce your risk of developing diabetes and enjoy a healthier life. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching!